Hello. Today we will talk about diseases caused by trace element deficiency. In this video we will consider the following questions. General principles of diagnosis and prevention of trace element deficiency. We will also consider some diseases. Cobalt deficiency or hypocobaltosis. Copper deficiency or hypocuprosis. Zinc deficiency and selenium deficiency. Here you can see the main literature describing trace element deficiency. All minerals in the animal body are divided into major minerals or macrominerals. These include calcium, phosphorus, magnesium, potassium, sodium, sulfur, and chlorine. Minor elements, trace elements. These include iron, zinc, fluorine, copper, manganese, molybdenum, and others. Ultra-trace elements. These include selenium, cobalt, arsenic, nickel, germanium, argentum, and others. Usually, trace elements and ultra-trace elements are collectively called trace elements. Trace elements, based on their biological effect on the animal and human body, are divided into limited evidence biological action in mammals. Essential trace elements. Elements considered possibly essential action, but it is not confirmed. There are diseases associated with trace elements. Trace element deficiency. Diseases that occur due to lack of essential trace elements in the body of humans and animals. The next one is trace element toxicity. Occurs when an organism consumes too much of an essential trace element or accumulates to a non-essential toxic element. And the last one, trace element imbalance. Occurs when there is an excess or deficiency of essential trace minerals and an accumulation other, toxic or even necessary elements, impacting health by disrupting bodily functions. Trace element deficiencies are classified as endemic disease. This means diseases that occur in certain biogeochemical zones and provinces, which are characterized by insufficient or excessive content of mobile forms of trace elements in soils, water sources, and plants, which causes a biological reaction of local flora and fauna. These diseases are also called enzootic. Why are we talking not only about insufficient but also excessive content? Because trace elements have antagonists. With an excess of antagonists, a secondary deficiency can also occur. Due to the interaction of environmental factors, nutrients, diseases, genetic factors, and medications, deficiency of one or more elements can occur even when the recommended levels of these nutrients are consumed. Evaluation of trace element status can be difficult because many diseases will change blood analyses used to evaluate nutrient adequacy. Proper dietary and animal evaluation, as well as response to supplementation, are necessary before diagnosing a trace element deficiency. For the diagnosis of trace element deficiency, we take samples of blood, hair, soil, and feed. We use biochemical and spectrometric research methods. We can also determine the level of, for example, glutathione peroxidase instead of the content of the trace element itself, to determine the level of selenium. After we identify the disease, we can create a treatment plan. General principles for the prevention and treatment of trace element deficiencies include application of trace element to the soil. Adding trace elements to the premixes, taking into account their content in feed and water, and the needs of animals, which depend on their species, age, productivity, physiological state. With a very low content of some element, focus on the minimum need. When you use a complex of trace elements, take into account the antagonism and synergy of the action of their. Take 2-week breaks every 2 to 3 months of treatment or prevention. Treatment doses of trace elements are 2 times higher than prevention. Now let's study some diseases caused by a lack of trace elements. And the first of them is cobalt deficiency or hypocobaltosis. It is an endemic disease caused by a deficiency of cobalt in the body and characterized by anemia, progressive weight loss, distortion of taste, anorexia, disorders of erythrocytopoiesis, protein and carbohydrate metabolism, osteodystrophy. Occurs more often in ruminants, sheep, goats, cattle. Less often in pigs, horses, poultry, rabbits. Etiology. Cobalt deficiency in ruminants occurs due to cobalt deficiency in pastures and forages. For ruminants, cobalt is necessary for the synthesis of vitamin B12 by the microflora of the rumen. Therefore, the level of vitamin B12 depends only on the level of cobalt in the diet. While plants absorb cobalt from the soil. A cobalt level in the diet below 0.05 mg per kilogram of dry matter is considered insufficient. A monogastric animal such as horses, dogs, cats, pigs, and others generally require preformed vitamin B12 in their diet, as they cannot synthesize it efficiently from cobalt. However, they are less sensitive to cobalt deficiency, and more sensitive to vitamin B12 deficiency. Cobalt deficiency also occurs with an excess of its antagonists such as manganese, iron, calcium, strontium. Antagonists are substances, often an excess micronutrient or a foreign element, that interfere with the absorption and function of other micronutrients by blocking transport, competing for protein binding, or disrupting their metabolism. Pathogenesis. Violations of hematopoiesis. The primary biological function of cobalt is to be as a central component of the vitamin B12, cyanocobalamin, molecule. Vitamin B12 contributes to the maturation of erythrocytes. In case of deficiency, macrocytic megaloblastic anemia develops. Megaloblastic anemia, a type of macrocytic anemia where red blood cells are abnormally large and immature. Vitamin B12 stimulates carbohydrate metabolism, has a lipotropic effect, and stimulates the protein synthesizing function of the liver and its reparative processes. Enhances nitrogen assimilation, stimulates the vital activity of microorganisms and the synthesis of bacterial protein. With its lack, protein assimilation decreases, a negative nitrogen balance develops. Cobalt ions indirectly stimulate alkaline phosphatase, disrupt the synthesis of the organic and mineral part of the bone, develop enzootic osteodystrophy. The main symptoms of cobalt deficiency are decreased appetite, especially for cobalt-poor feed such as grain, potatoes, straw. Distortion of taste, allotriophagy. Animals eat contaminated bedding, feces, rags, fences, paper, and other. Calves and lambs lick their own hair, drink urine. The other symptoms of cobalt deficiency are reduction of fatness and productivity, dullness, a rough coat, and delayed hair loss during shedding. The skin loses elasticity, becomes dry, peels. We can also observe pale membranes due to macrocytic anemia, cardiovascular disorders, myocardosis. Signs include weakened, muffled, split, or bifurcated first tone, a weakened second tone, and endocardial murmurs. Skeletal disorders, osteodystrophy, grinding of teeth, and wobble of incisors. Reproductive disorders, postpartum endometritis and low weight of newborn animals. Urinary metabolic findings, oliguria, reduced urine output, ketonuria, ketones in urine, and glycosuria, glucose in urine. Changes in morphological and biochemical indicators of blood. Oligocythemia, oligochromemia, polychromasia, anisocytosis, poikilocytosis, hypoproteinemia, Decrease in the content of cyanocobalamin. Decreasing cobalt content, 1.5 to 2 micrograms per 100 milliliters against 3 to 5 in the norm. This disease should be differentiated from alimentary dystrophy, copper deficiency, paratuberculosis. Treatment and prevention of hypocobaltosis. Pastures poor in cobalt should be fertilized with superphosphate, to which 1 to 5 kilograms of cobalt per hectare is added in the form of cobalt sulfate. It approximately 20 to 21% pure cobalt. Cobalt chloride contains about 24% cobalt, but the chlorine content may be undesirable for chloride-sensitive crops. Cobalt chelates, CoEDTA, an organic form where cobalt is protected by a special shell. This is the best option for alkaline soils, where standard salts quickly become unavailable to plants, but it is significantly more expensive. Animals are given fodder rich in cobalt and cyanocobalamin, fodder yeast, fermented fodder, silage, molasses, fish and meat, bone meal, clover, alfalfa, beet pulp, especially sugar beet. Cobalt salts are given in the form of aqueous solutions. We can use cobalt chelates. Animals are given complex vitamin and mineral supplements that contain cobalt. Cobalt boluses are also used for ruminants. A bolus is simply a large pill containing a piece of cobalt, which remains in the rumen and slowly dissolve. The next disease is copper deficiency or hypocuprosis. The disease is caused by a deficiency of copper and is characterized by a violation of hematopoiesis, a change in the color of hair, wool, a violation of the functions of the digestive organs, dystrophic processes in the central nervous system. It occurs more often in cows and sheep, especially lambs, less often in other animals. Lambs and goat kids have enzootic ataxia, swayback. The cause of the disease is lack of assimilated forms of copper in soils and plants. There is not enough of this element in peat soils, somewhat more in sandy and podzolic soils. The need for copper, milligram per kilogram, of dry matter of the diet, in cattle is 5 to 10, pigs, 8 to 11. Copper-poor feeds include grass, cereals, corn, asparagus, milk. Copper deficiency in calves can be caused by using milk replacer or feeding pelleted feed. Pathogenesis of hypocuprosis. Copper enzymes are ceruloplasmin, cytochrome oxidase, tyrosinase, amino oxidase, which catalyze individual stages of tissue respiration. Copper plays a crucial supportive role in hematopoiesis, primarily by promoting iron metabolism. It acts as a cofactor for enzymes, such as ceruloplasmin, which are essential for mobilizing and transporting iron from storage sites to the bone marrow for hemoglobin synthesis. Adequate copper is vital because iron cannot be effectively incorporated into the red blood cells without it, and a deficiency can lead to a specific type of anemia microcytic and hyperchromic that is resistant to treatment with iron alone. With a lack of copper, the formation of wool protein, keratin, is disturbed, resulting in depigmentation of the wool. Copper deficiency increases the content of soluble collagen and delays its transformation into mature collagen, so diffuse osteoporosis occurs. Clinical signs of copper deficiency are usually seen in young animals at pasture and manifest as poor growth rates. Depigmentation classically manifests as a gray-brown discoloration of the coat, especially around the ears and eyes, giving it a glasses appearance. Defective keratinization can lead to the formation of a thin, dry, sparse hair coat. There is also an expansion of the growth zones of the long bones of the legs, which leads to lameness. Anemia occurs after prolonged and/or severe periods of copper deficiency. Copper deficiency has been associated with reduced fertility. Impaired fertility is associated with secondary copper deficiency due to high molybdenum intakes rather than primary copper deficiency. Diagnosis of hypocuprosis includes determination of plasma copper concentrations are suitable for diagnosing clinical disease, but not for assessing copper reserves in the body. Liver biopsy samples are the best samples to take to measure copper reserves. Response to supplementation is the most important indicator of deficiency. Thus, we administer minimal copper supplements to the animal and monitor blood tests. This disease must be differentiated from intestinal parasitism, insufficient energy and protein in feed, lameness caused by osteodystrophy, calcium, phosphorus, and vitamin D imbalance, anemia as a result of sucking lice, neonatal ataxia in lambs, cerebellar hyperplasia, hypothermia, meningitis, sudden death as a result of other causes. Treatment and prevention. Animals are given feed rich in copper, such as millet, clover, dry pulp, molasses, yeast, bone and meat meal, alfalfa, split peas, and soybeans. Copper sulfate 3 to 7 kg per hectare is applied to pastures. Copper salts are introduced into the composition of premixes. Oral copper supplementation via the feed can be a very effective method of controlling copper deficiency. Now, zinc deficiency. A disease characterized by a metabolic disorder, a violation of the process of keratinization of epidermal cells, parakeratosis, a violation of the formation of bone tissue, hematopoiesis, reproductive function, reduced or cessation of growth of young animals. The disease occurs in animals of various species, cattle, pigs, poultry, but it is most pronounced in pigs in the form of parakeratosis. Parakeratosis is the failure of skin cells, keratinocytes, in the top layer of skin cells, stratum corneum, to fully mature, resulting in the abnormal retention of their nuclei. The etiology of the disease is insufficient intake of zinc in the body due to a deficiency of its mobile forms in soils, water sources, and fodder. Zinc is more available to plants in an acidic environment, pH 5.6 to 6.9. Corn and milo-based feedlot diets do not provide enough of zinc, while wheat is considerably richer. For corn and milo diets, zinc supplements needs to be added. Zinc deficiency in ruminants occurs with an increased content of phosphates and phytic acid in the diet. In piglets, with an excess of calcium in the diet. Parakeratosis in pigs can develop with normal zinc content if calcium in the diet is more than 1.5%. The intensity of zinc assimilation is also inhibited by cadmium and copper. The absorption of zinc is negatively affected by the deficiency of vitamins D and A. So even when we have enough zinc in our diet, there may be a deficiency due to an imbalance of other elements. In case of zinc deficiency, specific changes occur in the epidermis, characteristic of parakeratosis. The epidermis thickens significantly, at the expense of the surface layers. The granular and light layers disappear. Insufficiently keratinized cells accumulate in the stratum corneum, in which nuclei are visible, nuclei are retained. Signs of zinc deficiency include reduced feed intake and rate of gain. Symmetric, crusty skin lesions, parakeratosis, appear over the dorsum, ears, and tail, and become thick and fissured. Localized areas of erythema appear in the skin on the ventral abdomen and inside the thigh, and develop into papules 3 to 5 mm in diameter, which are soon covered with scales, followed by thick crusts. These crusts are most visible in areas about the limb joints, ears, and tail and are distributed symmetrically in all cases. Little scratching or rubbing occurs. Secondary subcutaneous abscesses occur frequently. Affected boars have testicular abnormalities that impair fertility. Moderate diarrhea is common. Symptoms in ruminants are as follows: alopecia over muzzle, ears, tail, hind legs, flank, and neck. Loss of wool and thickened skin in sheep. Poor growth. Swelling of the coronets, hocks, and knees. Wrinkling of the skin of the legs, neck and head, especially around the nostrils. Hemorrhages around the teeth, ulcers on the dental pad. Symptoms in dogs are as follows: lack of protection from infection. Abnormal iodine metabolism. Interference with normal cell developments including wound healing and replacement of intestinal lining cells, skin cells, hair, and nails. Sexual dysfunction, important in breeding animals. Clinical diagnosis, especially of adult animals, is difficult. The content of zinc and its synergists and antagonists in the diet must be taken into account. A good indicator is the content of zinc in the hair, in cattle, 100 to 130 mg, in pigs, 150 mg in 1 kg of dry matter. Differential diagnosis: eczema, furunculosis dermatitis, sarcoptosis, pellagra. Treatment and prevention include feeding foods rich in zinc, wheat bran, dry yeast, cereal and legume grains, meat and bone meal. In case of parakeratosis in pigs, zinc should be added to diet immediately at the rate of 50 mg per kilogram dry mass, 200 mg of zinc sulfate or carbonate per kilogram of feed. The calcium level of the diet should be maintained at between 0.65% and 0.75%. The injection of zinc at a rate of 2 to 4 mg per kilogram body weight daily for 10 days is also effective. Finally, disease for today is selenium deficiency. Characterized by biochemical and morphological changes in skeletal muscles and myocardium and other organs, disturbances in mineral, protein, and carbohydrate metabolism. Selenium deficiency causes a number of diseases in the body: white muscle disease and myopathy in young animals of various species, toxic liver dystrophy in piglets, exudative diathesis in poultry. Disease occurs in lambs, calves, piglets, foals, chickens. The etiology of the disease is selenium deficiency in soils and plants. High concentrations of selenium are found in soils rich in humus and in alkaline soils. In acidic soils, selenium forms insoluble compounds with ferrum and is poorly absorbed by plants. In cold and rainy years, the selenium content in plants decreases. The disease occurs when the selenium content in feed is less than 0.08 mg per 1 kg of dry matter. The assimilation of selenium decreases with a lack or excess of calcium. Increased consumption of sulfur, cadmium, and copper increases the need for selenium. Tocopherol deficiency contributes to the development of the disease. Selenium absorption is about 85% in monogastric animals and 35% in ruminants, due to the peculiarities of ruminal digestion. Selenium is a component of more than 20 selenoproteins. The best known of these are the glutathione peroxidase family, the iodothyronine deiodinases, and the thioridoxin reductases. Glutathione peroxidase, which exhibits antioxidant activity, protects the body from the accumulation of hydrogen and organic peroxide compounds that destroy cell membranes. Iodothyronine deiodinase, enzymes that catalyze the processes of activation and inactivation of thyroid hormones. A lack of selenium impairs the function of these enzymes, leading to symptoms of hyperthyroidism, which results in a decrease in the level of metabolic processes in the body. As I said earlier, white muscle disease is the most common manifestation of selenium deficiency. The pathogenesis of white muscle disease lies in the reduction of glutathione peroxidase activity. This leads to a decrease in the destruction of lipid hydroperoxides. Dystrophic changes occur in skeletal muscles and myocardium. Myocyte dystrophy and secondary coagulative necrosis develop. Muscle fibers are lysed and replaced by connective tissue. Skeletal muscles show a significant decrease in myosin protein content. Muscles become white and look like boiled meat. Vitamin E and selenium work in tandem. The action of tocopherol is aimed at slowing down the process of formation of peroxide compounds in tissues. Therefore, with its deficiency, pathological changes in the body worsen. Muscular dystrophy, white muscle disease, is the most commonly seen form of selenium deficiency in calves. The signs of white muscle disease include: the calf is fully conscious and has a normal appetite, temperature, and respiratory rate, though the heart rate may be raised. The calf may stand and move stiffly. It is weak and reluctant to move. In some cases, the affected muscles are swollen and hard on palpation. Other signs of selenium deficiency in calves: growth retardation. May develop anemia. Increased susceptibility to infectious diseases. Potential to develop chronic skeletal and weakening of the heart muscles, cardiac myopathy, if the cow is deficient. Sometimes, a perfectly healthy-looking calf may suddenly collapse during or shortly after feeding. Death is sudden and usually occurs within a minute of collapse. Sudden death syndrome, SDS. Adult cows with a selenium vitamin E deficiency may be more likely to retain the placenta, have an abnormal calving, and are more susceptible to metritis and cystic ovaries. Fatty dystrophy of the liver, kidneys, and ovaries develops. Symptoms of hyperthyroidism. Clinical signs of low selenium vitamin E status in adult cows are more difficult to determine. In pigs, symptoms of selenium deficiency may differ from those in ruminants. Two principal presentations can be seen at post-mortem examination. Mulberry heart disease, MHD, is caused when toxic peroxides attack the heart muscle, leading to heart failure. The heart usually looks enlarged and has white streaks, necrotic areas. Because the heart is failing, fluid builds up in the lungs, edema. MHD typically strikes the fastest-growing pigs because their rapid development creates a high demand for the antioxidants vitamin E and selenium. Hepatosis diatectica. Here the damage is done to the liver. The liver is enlarged and engorged with blood and has split, resulting in hemorrhage into the abdomen. To make a diagnosis, the enzootic situation and the place where livestock are grazing are taken into account. Selenium content is determined. In feed. In the blood of sick animals. In the liver. In milk. The activity of creatine kinase and glutathione peroxidase in the blood of animals is determined. Treatment and prevention. High in selenium, wheat, corn, barley, soybean meal, linseed meal, selenium yeast. Astragalus, milk vetch, have the unique ability to absorb and concentrate extremely high levels of selenium from the soil. Because of this ability, consuming high selenium Astragalus species can lead to severe selenium toxicity, known as alkali disease or blind staggers, in grazing livestock. A sodium selenite, from 0.1 to 0.2 mg per 1 kg of the animal's body weight in a 0.1% solution or other selenium preparations, is used to treat animals. Preference is given to organic forms of selenium, Saleplex. Selenium supplements often also contain tocopherol acetate, vitamin E. Methionine and cysteine are also useful for improving liver function. Now you have learned a little more about diseases caused by a lack of trace elements. Thank you for attention.